Welcome back. The month of May is Hepatitis B Awareness Month in San Francisco. Assemblywoman Fiona Ma and community partners, including ABC7, are planning events to educate the public about the health risks of the virus, and those include free Hep B screenings. The virus has been identified as a major cause of liver cancer, especially in the Asian and Pacific Islander community. Officials say 1 in 10 people of Asian Pacific Islander descent in San Francisco have an undiagnosed Hepatitis B infection. Assemblywoman Ma says she is the poster child for Hep B.
I was born with Hepatitis B. My brother was also a chronic B carrier. However, my sister, who is 16 years younger than me, does not have Hepatitis B, and that's because she was vaccinated at birth.
Well, joining us is someone who is also living with Hepatitis B, Sandy Andrada, and Janet Zola. She's the health promotion specialist with communicable disease control and prevention at the San Francisco Department of Public Health. Thank you both for being here today.
Thank you.
Thank you for having us.
Sandy, tell me about Hepatitis B in your life. How was it diagnosed? How did you find out?
Well, I was 24, and at the time I was working in a high-stress job in Silicon Valley. And everything was going fine until one day my coworker came up to me and said, "Your skin looks yellow, and the whites of your eyes are yellow, and you haven't been the same for a week now."
My goodness.
And at that time, my mother had just started working with Dr. So in the Asian Liver Center.
You never even imagined that this
Never met, no. And the first thing I thought of was, oh my goodness, I should get tested. I had never been tested for Hepatitis B. I went straight away to my doctor, was tested, and found that I was a chronic Hep B carrier.
But you didn't have liver cancer yet?
No.
So what did you do?
Right away, everybody around me, my family, then my fiance, I asked everybody to get tested and then vaccinated. And then I went to visit Dr. So at Stanford, and he started me on lamivudine, which is a pill that I took once a day orally, and that really helped stabilize my liver numbers. I changed my diet, I exercised more, and you know, I felt a lot better.
You're good now?
Yeah, I'm great now.
All right, Janet, tell me about the San Francisco Hep B Free campaign. That's a mouthful.
Yes, it is. It is. It's an unusual campaign. I don't think anything like this has been done before, not around a particular health issue that affects the Asian Pacific Islander community, or maybe even in this way around any. We are intent on raising the awareness about this disease and among the risk population, among the entire community actually, as well as among the medical providers. And along with that, we're eager to see that all of our Asian and Pacific Islander population finds a way to get screened if they're susceptible, to get vaccinated, if they're infected, to be referred into care so they can be followed. Not everybody needs to be treated, but the only way to know that is to first know if you're infected and then to be followed so that if some negative impact is happening, it can be stopped before it goes on to be liver cancer.
And Janet, the first person who would do that for you is probably your doctor, right?
The best place is at your own doctor or clinic's office. Okay. We set up these standalone clinics to break down some barriers to people who don't like to make appointments, to get people who aren't insured. And we are in San Francisco, as is typical of what we do in San Francisco, trying to create a model that can be replicated anywhere else in the country.
That's great. Sandy, tell me about you. You've had a family now, right?
Right. About 3 years ago, I had my first child, and then 2 years later, I had my second child. And with both of them, the immediate conversation with my OBGYN was, we need to make sure that both kids, the kids are vaccinated right away. First, right after my son was born, he was given the HBIG vaccine and then a series of 3 hepatitis B vaccine. And he was tested antibody positive, so he will not contract hepatitis B.
Thank goodness. All right, and Janet, very quickly, we're almost out of time. Your event's coming up May 17th.
On May 17th is the 4th Annual Asian Heritage Street Celebration, at which time there will be free screening for anybody who is interested, so we encourage people to come out and take advantage of this.
Great. Thank you both so much. Thanks for sharing your story too, Sandy. I appreciate it.
Thank you.
Thank you.
All right, for a list of the screening and vaccination sites in San Francisco, just go to sfhepbfree.org. Stay tuned. We're going to hear about another significant disease affecting our minority communities in just a couple of minutes.